Pediatric freezer pops are used to replace fluids and minerals lost due to diarrhea and vomiting in children. They help prevent or treat dehydration, which is important for the normal functioning of the body. It is recommended to give these freezer pops to children in the recommended dosage at the onset of diarrhea or vomiting. When giving pediatric freezer pops to your child, make sure to follow the instructions from your doctor or the product package. Some brands need to be mixed before using, while others should not be mixed. If it's a liquid form, shake the bottle well before each dose. If it's a powdered form, mix the contents of the packet in water as directed on the product package and stir until completely dissolved. Do not heat the product unless the package says it's okay to do so. The dosage will depend on your child's medical condition and how they respond to the treatment. Do not give fruit juices or foods with added salt without your doctor's approval. If your child's condition gets worse, lasts for more than 24 hours, or if they experience severe stomach/abdominal pain, blood in the stool/vomit, a fever, or signs of dehydration, such as dizziness, decreased urination, severe thirst, very dry mouth, seizures, contact your doctor immediately. If your child experiences mild nausea or vomiting after taking pediatric freezer pops, try giving it to them slowly in small amounts with a spoon. If these effects persist or worsen, contact your doctor or pharmacist. Your doctor has determined that the benefits of this medication outweigh the potential side effects. It's important to note that many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if your child experiences any serious side effects, such as dizziness, unusual weakness, swelling of the ankles or feet, changes in mental or mood, or seizures. While rare, a serious allergic reaction to this product can occur. Seek medical help right away if your child shows symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's essential to note that this is not a complete list of potential side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before giving this product to your child, make sure to inform your doctor or pharmacist about any allergies they may have. This product may contain ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. If your child has difficulty keeping fluids in their stomach, trouble urinating, or intestinal blockage, it's important to consult with a doctor or pharmacist before using this product. If your child is going to have surgery, it's important to inform the doctor or dentist about all the medications and products they are using, including prescription drugs, non-prescription drugs, and herbal products. If your child is pregnant or breastfeeding, it's important to consult with a doctor before using this medication, as it is unknown if the product passes into breast milk. When giving your child pediatric freezer pops, it's important to be aware of potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products your child is using, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to the dosage of any medicines without consulting your doctor. Some products that may interact with pediatric freezer pops include mineral supplements, such as potassium. Always consult with your healthcare provider to ensure the best timing and dosage for your child's specific needs. If a person has taken too much of the pediatric freezer pops and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the United States, residents can contact their local poison control center at 1-800-222-1222. For Canadian residents, they can reach out to their provincial poison control center for assistance. Make sure to attend all your medical appointments and follow-up lab tests. Once your child's condition starts to improve, they can begin to eat soft, bland foods like rice, bananas, toast, boiled potatoes, or any other foods that have been recommended by their doctor. Pediatric freezer pops are a type of medication that is used to help reduce fever and relieve minor aches and pains in children. These freezer pops are often given to children who are unable to swallow pills or tablets. The recommended dosage for pediatric freezer pops is based on the child's weight and age, and it is important to follow the dosing instructions provided by the healthcare provider. It is important to note that pediatric freezer pops should not be used for more than 5 days for pain or 3 days for fever without consulting a healthcare provider. It is best to give pediatric freezer pops to children when they are experiencing discomfort from fever or minor aches and pains. Always consult a healthcare provider before giving pediatric freezer pops to children under 2 years of age. Make sure to check the storage instructions on the package. If you're unsure about how to store the pediatric freezer pops, ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of the pediatric freezer pops, don't flush them down the toilet or pour them down the drain unless you are specifically told to do so. Instead, make sure to properly dispose of the product when it is expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.